Hi, my name is Dr. Higgins. I'm a GP based at Bridlington Surgery and the Clinical Director for Tame Valley PCN. I wanted to just send out a quick message about an issue that we've seen an increase in over the last few months and years really, and you might have seen some information about this in various media outlets and on social media and so forth, and that's the issue about a drug called ketamine. So ketamine is a drug that can be prescribed in certain circumstances for certain types of pain, and it's also used as an anaesthetic, and in veterinary fields it's used as a horse tranquilizer as well. So it's a very, very potent drug, but we're seeing increasing use of ketamine as a street drug or as a party drug. Some of the effects from a party perspective is it can give you a feeling of a high, of some hallucinations. It can also give you a feeling of dissociation or detachment from reality. However, within that then comes some serious risks, because with it being an anaesthetic, you don't necessarily feel pain whilst you're using this drug. So you could come to serious harm. You could fall, for example, and break a leg and not even realise that your leg is broken because of the potency of the pain-killing effect of this drug. The other thing, if you're taking it for a period of time, it can affect mental health. It can cause low mood. It can cause psychosis and schizophrenia type symptoms, as well as flashbacks and memory issues, which can be quite long lasting as well. But one of the bigger things is over the medium to long term of use of ketamine, you can develop significant problems with the bladder. So that can result in urinary frequency, so passing urine very often, passing very small amounts of urine, burning when you wee, and sometimes passing blood as well. And the problem with ketamine use is that if it does start to irritate the bladder, it can cause inflammation and scarring of the bladder. And when that happens, the bladder starts to shrink. And if the bladder shrinks and becomes scarred and shrunken, then it can't hold much urine. So that means that you then have to be passing urine very, very frequently, sometimes as often as every 10 or 15 minutes. And once that damage is done, it's often irreversible, and you're stuck with those symptoms then for the rest of your life. Sometimes people end up needing to have surgery to try and bypass the bladder, so to actually get the urine direct from the kidney through a bag put on the side of the body that you then have to wear lifelong. So it's a really, really significant problem, and it's something that can be avoided by simply stopping the ketamine use at an early enough stage before that damage is caused. There's lots of support available in Stockport if you are using ketamine, or if you know somebody who is and you feel like you need some help to try to stop, or if you feel they need some help to try to stop. We've got the START service for anybody over the age of 26, which you can refer yourself to, or for people under the age of 26, Mosaic have got really good support. And there's also some really good online support through weekly Zoom meetings that are based in Stockport for the whole population of Stockport, and those are accessible to people who use ketamine. There's women's only groups, and there's also family support groups as well. So if you have somebody that you know that is using ketamine and you want some support from other people who are going through the same as you, then there's access online for those as well, and I'll share all of the links and the login details for those groups with this message. In addition to that, there's support around ketamine through the Talk to Frank website, and we're here for you as your GPs as well. So if you want some extra support, you want to make an appointment to discuss it further, then please do get in touch with reception and we can help you with this. Thank you very much.